The reason we're here today is because it's Health Day at COP29. And so we thought we'd have a bit of a healthy conversations on climate and environment, bringing you some dispatches, like our friendly journalists there, Kimberly and her colleague, who will both introduce themselves in just a second. So these are our reporters in the field at Baku, while many of us are here in Australia and elsewhere, not physically present. So it's great to have some insights from the ground. Folks, I'm your host, Adi Vias. I'm a public health physician and associate professor of public health at the NHMRC HEAL Centre, Healthy Environments and Lives at University of Canberra. Enormous thanks to both Kate Wiley and Michelle Isles for co-hosting this session from Doctors for the Environment and the Climate and Health Alliance, two critical organisations as we move forward into this sort of uncharted territory of the climate crisis. Let me also acknowledge the land and the planet and the people where we all separately live and work and travel. For me, I'm in Sydney on Wellamadigal land on the Parramatta River. So I'd like to pay my respects to First Nations people in all the lands where we are. Kimberly, you have a guest there with you. Thank you very much for joining us live from COP29. What's the mood on the ground?
Hello, hi. I'll introduce myself first. For those I don't know, I'm Kimberly Humphries, emergency physician, public health doctor, board member for DEA, work a lot across various different areas in the climate and health space. And
hi, I'm Sibel Day. I'm a child and adolescent psychiatrist and a researcher on climate and mental health. I'm also part of the Climate and Health Alliance and Doctors of the Environment Australia, and I'm here particularly to engage around climate and mental health with the Medical College, Royal Australian and New Zealand College of Psychiatrists.
Fantastic to have you, Sibel and Kimberly.
Yes, so mood on the ground. That's quite tricky, I think, because for us, existing in a few different spheres. So from health, we have a very energized health community here. I think the health community is smaller than it has been in previous years. And some of that is around the fact that this is a finance COP. And so, there was perhaps less emphasis on the kind of things that the health community have engaged with in the past. That said, there's still a lot of health people here on the ground. And I think the mood within health is pretty energetic and we all energize each other, collaborate. I think there's potential for exciting things to come out of the health community for COP. I guess COP in general has been probably quite frustrating to this point because there hasn't been a lot of progress. This is a finance COP. And so the idea around this COP is moving along with the finance and the new collective quantified goal around finance. So basically, crudely put, the global north particularly putting money in to ensure that there is a just and equitable transition across the globe, including loss and damage and supporting health and wellbeing for communities everywhere. We haven't seen the progress we want to see yet. There's still another week of COP to go. And my very limited experience with COPs is sometimes this is the feeling at the end of the first week and then the tide turns and we see some really good progress in the second week. So fingers crossed.
Yes, I guess the thing I would add is I'm struck by how many people seem to be identifying the need to cross silos and the need to actually between different groups when they're speaking. And I think the fact that that's being talked about and thought about in so many spheres is really important. So I've just been hearing people speaking about that in the context of funding for some lighthouse projects on climate and health intersections in the Asia Pacific region.
Fantastic. Now, for those who are less familiar with the COP process, happy for any four of our panelists today, Sibel, Kimberly, Michelle, or Kate, just orient us a little bit about what is COP, this conference of parties where countries from around the world, but also much larger delegations of people from different sectors come together. Who wants to jump in and give us a bit of a potted history or a potted overview?
I might kick off and then defer to those with more expertise in this, so I could just give my little bit. So I guess there's two different kinds of parts to COP, and some people are really well versed with one part and not so well versed with the other one. How it started is basically multilateralism, so across countries coming together to have the discussions around climate, to make the formal agreements that exist across the globe for what we need to do. So out of that came things like the Paris Agreement, for example. And now we have COP every year where countries come together and negotiate on the different things we need to do, set new goals, revise where we're going, and do that, we hope, in a collegial way that involves everybody across the globe. Now, there's various, we may well delve into all the issues with the COP process during this talk. The other part of it, which often gets lost, and the reason that I come to COP, and I'm sure probably Isabel comes to COP, is the civil society aspect. So there's actually more people here from civil society than there are negotiators. So although the process started off very much UN negotiators negotiating where we need to go with agreements, now it is civil society, academics, people from across the globe who are having conversations on the sides that aren't part of the official process, but some incredibly powerful things come out of that. So pacts are formed, agreements are made, money exchanges hands. That is the really energizing part of COP for me, because I think you can learn a lot and there's the potential to create incredible change that's not part of the usual UN negotiation process.
Michelle.
Thanks, Kimberly. Look, I think you've got it in a nutshell. We're obviously up to COP29, so there have been many of these meetings. And as Kimberly said early on, it was really about the negotiators. And the negotiators meet, I should say, from each nation throughout the year. So this is kind of the culmination of those discussions. So there is still an ability to influence at the meeting, but a lot of the positions have been determined, and the negotiators do work into the night. And there's a lot of lawyers involved with, every word matters, and there's a lot of influence. So we've heard a bit about the fossil fuel interest. There are about 1,700 fossil fuel lobbyists, but as Kimberly said, because there is civil society there is philanthropists, there are other levels of government. Local governments played a strong role in being there. It's these actors that are actually coming together to tune in and then also counter and gauge the response they need. So COPs have happened for many years. It was in 2015 in the Paris Agreement where we really saw a landmark agreement which changed and gave us hope for sticking to below 2 degrees and aiming for 1.5 degrees. So that was a national agreement, an international agreement, where we would actually look at what are the safe levels for human health and climate change. And I'm letting people in as I'm talking. So, holding the governments to account to that agreement is still key to these decisions. But really, this COP is around financing and implementation of that. And what we're hoping is that governments don't move away from the agreement. We may see one government step out after this meeting, indeed. But really, those governments are committed to working towards that target.
Yeah, and it was, it was 196 member countries signed on to the Paris Agreement, and the COP is the conference of those parties coming together each time to make sure we do what we signed on to do. And of course, I suppose that's really where it becomes interesting, because we can see that although Paris was a landmark thing, here we are getting on to 10 years later, and really, are we moving forward or not? And, we can all see that, we're not. And, so has there been any, I'm really interested, Kim and Sibel, about, you say the finance COP. So have there been any big, good announcements, or is it all just we're waiting?
As far as I'm aware, Kate, there haven't been any really major big announcements. One thing that seems like it might be a sign of progress is that the discussions about how much money is needed to address, Kimberly, correct me if I'm wrong, but to address loss and damage is 1.3 trillion.
Yeah.
Whereas previously the numbers being talked about were less. So that seems like, and that was, I think, China starting that discussion. So actually raising the bar on that seems like it's potentially some progress. But I think there've been a lot of areas where, from what I'm hearing, there's a lot of trying to hold the line rather than seeing big jumps forward.
And I think that's the very frustrating thing as well. And this certainly was my feeling when the loss and damage fund was announced. Great. And that's really good. But where is the money coming from and who's committing to that? And I think we still see that. So announcements are made that sound great, but until we have countries, particularly the global north, step up and actually say, this is our commitment and we'll actualize that, then it's really just words on paper, which is not what we need right now.
Let's talk about some real dollars here. So 1.3 trillion sounds like a big amount and an important goal to aspire towards. Tell us a bit, Sibel and Kimberly, about what's happening for the health sector, because I recall from COP28 last year, many of us were there as part of the health delegation, very first health day last year. $1 billion was committed, and that was specifically for climate and health financing. Where's that up to?
Kimberly, I might defer to you if you have a good answer or have an answer for that.
This is some
Yeah,
hard-hitting
absolutely.
journalism
Look, Annie,
happening.
I know it's very hard-hitting journalism. Look, and I'll defer to Michelle and Kate as well if they have any information. I haven't heard any further about that. I haven't heard, aside from the announcement with Fiji about financing there, I haven't heard any other big announcements happening at this COP around money that's going towards health. Now, one of the things about COP as well is there's so much happening and so many health events happening at lots of pavilions. And I'm sure there have probably been some announcements, particularly on a country level, where there is investment and there is things happening. But I haven't seen any really big announcements so far. We know that today being Health Day, there will be a couple of announcements later today. So one is around the coalition, formalizing a coalition around health and climate. I think it's the presidencies from 26 to 30 and World Health Organization as well, making sure that that conversation continues. I think one of the concerns we had after the first Health Day was, is it's just going to signposting, virtue signaling, yay health, and then it doesn't go anywhere. And it's good to see that there is going to be some commitment to that continuing as well.
So we're not seeing
And
too much
this isn't-
health washing, although there might always be a risk of that.
Yeah, look, I think it's the same tension that we always have, where the sectors that aren't health go, what's health got to do with it? I mean, I think that still happens to a really significant degree, which is still something that we are trying to break out of our silo. I think within the health community, we're actually pretty good now at talking about the impacts of climate change, and a good number of us are really getting this and on board with it. But we're not finding that our message, I think, is getting out to all of the sectors yet. And that's not just an Australia thing, that is across different nations. But I think we're making progress. And I think we're seeing more, certainly at this COP, of health being involved in cross-sectoral discussions and presentations and workshops and things, which is exactly where we want to go.
There's certainly, this is not large announcements, but certainly the announcements yesterday with Kristen Tilley, the climate change ambassador, and Chris Bowen around supporting the women-led projects in Vanuatu and having local energy provided that included energy that would allow access to better healthcare. And that was actually a theme that was coming up in the talks that I've just been to from people working in India and working in other parts of Southeast Asia around having things like local solar power and energy so that the health service was more resilient to disruptions. So that there are some elements of linking health in and other social determinants like that electricity providing light and reducing the risk of people being assaulted and things because of literally lack of light.
Absolutely. And we will see an announcement later today as well around the operationalization, there you go, I did it, of the Health Impact Investment Platform as well, which is about $1.5 billion that a number of different banks, can't remember them all off the top of my head, but African Development Bank, I think, and an Islamic Bank and the World Health Organization, towards financing public health in particular in low and middle income countries. So that is really welcome.
That's really welcome.
And I would add that there are actually mental health events coming up later this week. There aren't any of them, as far as I'm aware, specifically today, but there are several over the next couple of days.
Kate sounds like she has a follow-up.
I just want to sort of put out there, so we've got this 2.5 million Pacific Climate and Health Resilience Package, right? And, that's to, support, Pacific Islands and, their health needs. And I think that's obviously a good thing in many ways. But is it just me, or, like 2.5 million? Does it seem like it could be a bit more? Am I the only one that sort of thinks that? If we gave 14.5 billion in subsidies to the fossil fuel industry last year as a nation, what percentage is 2.5 million of 14.5 billion? Like, it's not much, less than 1% or something. So does anyone else have that dissonance going on?
Absolutely my thought as well, Kate. And I guess the other very big elephant in the room is that we are still not doing what we need to do on a national level. We're still the third biggest exporter of fossil fuels. We are not decarbonising like we need to. And the impact that that has on our Pacific neighbours far outweighs that amount of money that we're giving as well. So to me, that's where we need to go. Yeah.
Yeah. And, you can feel that it's sort of a, it's a signal around, Australia supporting Pacific Island neighbours. What's the mood in and that's obviously, COP31, and will we get that bid? Does anyone talk about Australia there, in that light? Like, is there any sort of mood in the room about whether we'll get COP31 or not?
I don't think we know for sure, but I think the sort of side chats that I've been hearing is that there's actually very good support among a broad range of countries for an Australia Pacific COP in COP31, but that there's been an increase in the unwillingness to withdraw from the kind of the candidacy for that from Turkey, and that's the current sticking point. Not that there's really been a shift in terms of what most countries think would be most productive, which seems to be pointing to Australia in the Pacific, but I gather that there's a process thing where unless Turkey withdraws, we're kind of stuck. So that's my understanding from hearing.
Yeah, and what the word I've heard, which could be entirely inaccurate as well, is that we will likely not get an announcement around that during this COP.
At least we know that up front, as opposed to last year, where every day the climate negotiator for Australia was doing a briefing at lunchtime, and she would say, we should hear tomorrow. We should hear tomorrow. And that day never came. So at least now we know it'll be after this COP that we'll find out, maybe significantly.
Yeah.
Still rumours that there might be an announcement later in the week, but it's not every day.
Exactly. It's a maybe, but I think less likely than at the start of COP. But I think the mood was a lot more like we will know where 31 will be, and now it's a little less like that. There's been really interesting dialogue as well, and this is obviously not part of official high level anything, but particularly around civil society. And some of you may have seen the letter that came out a couple of days ago, Christine Figueres, Ban Ki-moon, around what we need to do for the COP process. And there has been a lot of talk and momentum around petrostates not having COP, and that COP should go to countries that have an NDC that is hitting the mark, which does not leave a lot of them, or at least is committing in a reasonable way to making this progress. And also that we should be moving towards a COP where fossil fuel lobbyists are not attending and not making oil deals and not kind of disenfranchising the whole process as well. So that's really interesting, I think, discussion and future for COP, because I've also heard previously, less this year, but the kind of momentum around this is a process that just needs to go in the bin and we shouldn't do it. Well, I think multilateralism is what we need to do to get global agreement on these things. We need to do it in a better way.
Michelle, tell us a bit about multilateralism from Climate and Health Alliance's perspective, because of course, in Australia, we're part of a few different groups. So you're part of the Global Climate and Health Alliance in some ways. Also, there's Healthcare Without Harm. Kate, from Doctors from the Environment perspective, there's also, medical associations and beyond, nursing, healthcare professionals generally. We're all starting to talk with one voice, or maybe you can argue we are well and truly talking with one voice. But what's the take there, Michelle?
Yeah, thanks, Addie. Absolutely. Just as CAHA is an alliance of really diverse organisations across our region, we were a founding member of the Global Climate and Health Alliance. And hopefully, Savelle and Kimberley, you've met some of the global team because they are well and truly involved in COP processes. And that's something that on behalf of this growing membership across Global North and South membership, they are advocating to safeguard health as we are here, and being able to reach and have connection with each and every government that is actually at the table as part of the Conference of the Parties is really powerful to have that collective messaging. There's been a long process in the lead up to COP around the positions. Yes, fossil fuels are absolutely on the table, and the Global Climate and Health Alliance does want the governments to make good on the commitments that were foreshadowed last year. So we'll see if that eventuates. But as you mentioned, Addie, we're a strategic partner with Healthcare Without Harm that works internationally, and we normally part of that delegation to not only at COPs, but at other international events throughout the year. So, Healthcare Without Harm has been involved in the G20 and health working groups with the World Health Assembly. So trying to get health on the agenda across all policies and across all governments at scale. And I think that's really the power of our movement and our connecting today, because this is happening across the world, and we've got these messages that they are getting cut through. I mean, in Australia, if we think, just to go back to the earlier discussion, I was with 15 Pacific Island health leaders and environment leaders this morning that the Department of Foreign Affairs have supported through a fellowship program, and that is about upskilling and preparing for climate change. There was a $600 million research grant released early. Australia knows we need to be working more with the Pacific. And so the COP31, yes, is a light on the hill that we're working towards, but we know what COPs do is signal that need to do the work. Australia needs to do better, absolutely, because while it's easy for us to assess and look at the oil states, we've just talked about the coal that we export and the pollution that we export. So we need to be doing that work. And what I've observed in these global networks is by having our international colleagues also be able to talk to the Australian government and have that inside out or outside in perspective and advocacy also helps to move our progress and commitment. So while we're advocating up, our colleagues are also putting pressure, and Australia and other nations have committed to attach. Love to see there are some meetings happening, and we've got a representative from the Australian government attending the international meeting that commits governments to targets and commitments around health and climate. So there are various mechanisms, and we're working inside track and in these with community, grassroots health workers having voice in various forums.
Yeah. Thanks, Michelle.
Yeah, and I mentioned as well, tomorrow is Attach Day here as well.
Tell us about
officially
Attach, the Alliance for
Attach Day.
Transformative Action on Climate and Health. Is that what it stands for? Go ahead, Kimberly.
Michelle, did you want to go?
Just go again. Go ahead.
Oh, sorry. Sorry, I thought, Kimberly, were you going to talk to us about
No,
that?
look, I'm happy to, or you can as well.
Yeah, please. Yeah, please. You've dialed in especially.
Yes, Sibylla and I are having a very hard time dialing. That's right. So the Alliance for Transformative Action on Climate and Health has been around for a couple of years now. So it was a big announcement a few years ago, which is really bringing together the kind of working groups around different streams about things we need to do. So, for example, there's one that's focused more on supply chains, one that's focused more on adaptation, green hospitals, different areas as well. And the idea of that is to bring together, once again, from across different countries and different organizations. So I'm the DEA focal point for Attach. And it's really capacity building and being able to share information with each other and across those processes. Now, there's more official parts of it as well, but there's also a really kind of rich database and rich network for sharing information, seeing what has worked, seeing what hasn't worked, making sure we're not reinventing the wheel, and that we're doing this in a really coordinated way. And that's under the World Health Organization banner. So it's just a lot of the networking that I think was happening, but has been formalized now.
Great, thank you. And Deanna from Healthcare Without Harm, who, Kimberly, I know you've caught up with at COP, who's the International Climate Director, and some people have seen Deanna in our opening event for the Greening the Healthcare Forum last week. Deanna is a lead for the low carbon stream. So exciting that we've got, again, obviously the Australian government representing and involved in those discussions, and be interesting to see how that progress there connects in with Australia's negotiations and discussions on broader fronts.
And I think that's a really good point to, I think it's often easy, and I know I'm very guilty of this, to kind of throw a lot of shade at Australia about what we're not doing, but we have made some really good commitments lately. So I think joining Attach was something we didn't do initially. and we have done now. So we're part of Attach. We've also joined in, there is a collaboration which initially was the UK and US government around decarbonising supply chains and net zero supply chains. We've now joined that as well. So I think particularly within health, there is some really good progress that's been made, of course, because people are working so hard on this.
I would add too that government representatives have reached out to us to have some meetings, and they're yet to happen, but we will be catching up with federal health people later today and tomorrow, and they are involved in presenting at various events. One thing I guess I'm hoping to see at the next COP will be that there will be a return to having health events at the Australian Pavilion, because we actually don't have any health events at the Australian Pavilion this time, and I think that's an opportunity that we need to make sure happens next time. Not that I'm not sure that it was really actually available this time, but hopefully there can be a process to get it.
I will say there were a couple of applications put in and they didn't get up. So, you know, we need to be on the front foot next year. And, you know, if you can have those conversations while you're there, making sure they're reminded of how important we are. That's great.
Absolutely. It's so important. And I think part of it is because I have previously looked at submitting things to the Australian Pavilion, and their criteria, what they want has been so, I think, exclusionary to health. The main part, it's really, we've been trying to fit a round peg into a square hole. So I think having those conversations say, actually, you need to make space for health in a viable way. It's so important. It is the lever for climate action, right?
And it's also the mechanism by which climate harms human beings.
Well, that's the thing. So, you know, if the World Health Organization, that's the theme, isn't it? Health is the argument for climate action.
Yes,
you know, and using that to sort of, you know, go into the different sectors.
100%. And I think that's the power of the health community. It's, yes, we need to do things like decarbonize our health systems. Absolutely. We need to adapt our communities and our hospitals, but we need to realize how powerful we are as a health community to be the argument for climate action, because I think that's how we're going to get a lot of the job done on a really big level.
Yeah, absolutely. And that's where, you know, we have that responsibility as well, don't we, as health practitioners, to do everything we can. You know, we all take this oath about, you know, consecrating our life to the service of humanity. And so this big global health problem is probably our lane. And also, you know, the trusted voice thing that we always go back to, and, you know, how embedded we are in our communities. We were talking before about multilateralism. And of course, that's important in this high level negotiation stuff, but it's also important with community transformation, that if we embedded in our communities health practitioners, and I'm thinking, you know, doctors, nurses, allied health, all of us, if we're there saying, hey, you know, we need to act on this, I think we can, you know, really make a difference. Yeah.
You know, that reminds me, Kate, and also kind of drawing on both those concepts, multilateralism, all the way down to the grassroots where real people live and real health gets created or damaged. That reminds me almost like in this conversation, it's only been, what, 30 minutes or so, but we've almost got a theory of change here, which I know some of our friends love to spruik, or a program logic, but that's what it is. You know, it's real people at the heart of it. Interestingly, and please tell us, Sibel and Kimberly, if this is the kind of feeling on the ground, but what's interesting is today's Health Day. 1 or 2 days ago, just before, you had a break day, I think, or a rest day yesterday, but in the Pacific Pavilion, our friends have no problems talking about health there. So for instance, Fiji government launched their Health National Adaptation Plan, and their Minister of Health was there, their Permanent Secretary was there, together with, you know, the large multilateral organizations that work in the Pacific, World Health Organization, the Secretariat of the Pacific Community. So tell us what's the feeling on the ground? Just give us paint us a word picture of what does it look like? Are the pavilions close together? Is there space to intermingle, or is things kind of separated out?
Yeah. So for those who haven't been to COP before, and for those who have, a lot of countries have pavilions. Not all countries have pavilions. For example, I went looking for the Costa Rica pavilion because I quite love what they do in a lot of their strategy, and they don't have one, but many countries do. So we've got you know, Canada, US, UK, Russia, Qatar, some African nations, etc. So there's not representation from everybody in a pavilion, but there is a lot of country pavilions. What happens at different COPs? So in Dubai last year, because of the infrastructure they had, the pavilions were in different rooms. So they had entire kind of office rooms that were Australia or the US or wherever, which I didn't find great for being able to work and learn from colleagues across different nations, let's say, because you go to Australia and you're in a room with Australia. This year, it's more like I've seen previously. So what it was like in Sharm el-Sheikh in Egypt, where it's a big kind of convention hall that has booths, basically. So if you think about a booth, if you go to a conference, but they're bigger than that, and that's a country. So you'll be at Botswana, and right next door is, Australia, for example. So you can kind of hear what's happening next door. People are kind of mingling back and forth. I think it's much nicer for making connections with people and breaking out of those silos a little bit. So lots of pavilions of varying sizes. You can imagine some of them are very small and just have a little table. Some of them are very big and very flashy with a lot of stuff going on. Various levels of representation as well. Once again, some countries obviously can't afford to put on a big show, and some countries will have a good deal of their ministers and high level officials there doing very fancy, important things and announcements and bits and pieces like that. But it's nice in the way that you can just kind of wander around and you can just wander past and see what's happening in Ireland, for example. And a good way to kind of get the vibe or the idea about how other countries are approaching this as well. That might be different to how things are in Australia, which Australia has good coffee but keeps running out of milk. So
Logistics.
Maybe that's it's symbolic. Or
Can we
you
ask
have coffee in
about
our pavilion. Go ahead, Kate.
what about the US pavilion? Have you sussed them out?
yeah, so look, the US pavilion, because the change hasn't happened yet. So I think the vibe is a little downcast, but they still have a full contingent of officials here. They're still making announcements, they're still discussing. And I think one of the things that we need to remember is what has happened in the US has the potential to be catastrophic for climate action across the world. But there is a lot of work that's happening at a state and local level, and a lot of people who will continue that work in the US, who are working really, really hard to advance things. And a lot of those people are here, and that work will continue as well. So not terribly upbeat vibe, Kate, but not completely depressing. It's still happening.
So more of a, okay, let's face the reality of this situation, but we won't let it derail us kind of vibe.
Right. Okay, we've got to get on with it. What do we
Right.
do when we're confronted with these challenges? We double down, we don't give up.
Right.
Tell us more about that. Is there a sense of solidarity amongst people, or is it mostly, it's such a vast, I'm not sure what the numbers are, but last year was something like 80,000 people turned up over the 2
I think
weeks.
it's 50 this year. Yeah. Did you want to speak to that?
I'm happy to I mean, I'm new to coming to COP, but I certainly do think there's a sense of solidarity, that there's a sense of, I went to the climate action, the Cannes international meeting for a bit yesterday, and there certainly was a sense of people from lots of different countries and lots of different civil society wanting to work together and actually talking about how important it was to be actually supporting key things and sort of say, holding the line about gender, for example, because there's been quite a big pushback to undo some of the things that have been previously agreed to. And so the importance of actually organisations and people speaking up on that, and on things like holding the global north accountable around fossil fuels. So there've been a number of actions, which even like today, there's been multiple actions, which I can send some pictures through, and they had to be modified based on the rules here. So they haven't happened in the way that they might have otherwise, but they're still happening. So there's quite a bit of, I think, solidarity and people speaking out in the ways that they're permitted to.
I think that's true. And I think that kind of touches on something we haven't really mentioned. That is, even if you are here like us, civil society, you're not a negotiator, you have the ability to attend negotiations, to view negotiations for the most part. Sometimes there's not enough room, we'll get kicked out. But to work with the policy team. So many of us here have been working with GCHA and the policy team as well, and having daily meetings. And there are fabulous people in these networks who craft texts that they put to negotiators that gets in the final version. So there is a degree of influence that we have as well that we can't forget.
That's a great point. The pen is mightier than the stethoscope sometimes, isn't it? And we have to roll up our sleeves and get involved in the conversation. So I'm really glad you're both there, representing the sector, the system, the country.
I think we're both incredibly grateful to be here. I think that COP, the reason I come to COP is it is so powerful and encouraging to meet people who are trying to do all the things we're trying to do. and we are better when we come together globally. So a couple nights ago, not last night, night before, there was a reception for the Fossil Fuel Non-Proliferation Treaty, which a number of health people went to, which is fantastic because that's not a health-focused event, but they are increasingly connecting with health and talking to people who are across the globe who are working towards these really, really impressive initiatives that are kind of, a lot of people aren't aware of them. They're kind of happening in concert to all of the other things. It makes you not want to give up.
Yeah. Okay,
Oh,
so it's
someone's
empowering.
got their hand up.
They do.
On-
Before we go to Angela, just I'll also say we are, you know, happy to keep going as long as you both have the energy, Kimberly and Sibel, but also mindful that you've got a full schedule and it's Health Day. So just let us know
Yeah.
when you need to wrap up. Angela, go ahead.
Oh, thank you very much. It's really interesting to hear your perspectives because I've been communicating with a friend of mine who's an engineer at a global level, and he just said, as you've said, he said that there's palpable urgency, there is solidarity, and also frustration with governments being so slow. Have you picked up on that last bit as well?
Oh, 100%, 100%. One of the things from that, so not wanting to give up on the process, and we've talked about why this process needs to continue, maybe be reformed, but needs to continue. But that doesn't mean we do the work. We don't do the work aside from that. So if you look at Australia, for example, many of the states are being very progressive with renewable energy, decarbonising, moving faster than the federal government is. That I expect is what we will see in the US as well. So the federal government may not be on board at all, but there are states who are really getting the urgency and are pushing incredibly hard on this. And I think you really feel that. I think, yeah, it's a matter of time. I really do. I think there are so many people here who understand, who get it. They may not be at the table negotiating, but there is that real feeling that things are happening and changing.
That's really good to hear because it's that's hard to pick up from through the media. That's a real in the room sort of sense, isn't it?
Definitely.
So yeah, thank you for that.
Yeah, I would certainly second that while there is a sense that there is a lot of challenges, there's also a sense that there's a lot of energy to actually keep going, and that people are, I think, being realistic about barriers and things, but also kind of thinking, right, strategically, what can we get done, and let's make sure we actually mobilise and get that done. And one other one, just in terms of those cross-sectoral things, I went to a presentation that was on the Global Methane Pledge, and while that was focused around mitigation and reducing methane emissions, it's actually just leading up to the event coming up on the 26th of November in Gadigal country, which is looking at the health impacts of methane. So there was an opportunity at the end of that with all these people who've been presenting some fantastic stuff about the practicalities of reducing methane emissions, and some great sort of hacks about how green steel can be, they can use 1% of their expenditure in order to reduce their emissions by a third. Which is certainly something I wasn't aware of. And then just actually saying, look, and in fact, this has got all these health impacts. So it would be great to see in the future if, when there's a presentation about reducing emissions related to methane, that there's also a presentation about, and there is actually a really important health reason to be doing this as well.
That's fantastic, Sibel. And, you know, a lot of the unsung heroes that are out there, people that are doing their work day in, day out, I really hope that we can take heart from the lessons you're drawing and the insights you're sharing with us. I mean, that's fantastic. You know, look what I have right here on my desk. Some of you might have seen this, but, you know, our very own Doctors for the Environment are out there. This is in the Australian, a full-page ad talking about, you know, fossil fuels being a health hazard, somewhat similar to smoking. And look, you know, there's 100 plus, Kate, you'll tell us, 100 plus names of various professionals who've signed up.
There's 421 signatures on that.
There you go.
In alphabetical order, just want to say. Yeah.
That makes me think, you know, and maybe this is a nice note to sort of wind our conversation down on, but Kimberly, Sibel, what solutions or kind of actions have you seen from, let's focus on health for a second, that we might be able to adopt in Australia as we go forward?
Yeah, one of the big ones, and this comes up time and time again, is that we need to work across sectors. So we cannot do this in our little silo. We need to be doing this with our partners in transport, in urban planning, in absolutely everything. And this has come up a lot of times in different conversations, and some countries are doing it well. Some countries are really kind of embedding this and bringing health to the table across everything that they do. I think that has to be a focus that we continue to really push for really, really hard. And as you said as well, I think actually thinking about tangible solutions, and many of them are solutions that have co-benefits, right? Not just looking at this in a really short-term way, but looking at this long-term. How can we build better and healthier cities? This is not just about, oh, yep, we've got to get our carbon emissions down, but actually if we have a city that is green, that has lots of walkable and cycling space, that we move cars out, as we've seen it happen in Europe. I mean, Paris has done it. Many cities are closing off their city centers to cars, and it has incredible economic benefits. It has incredible benefits for health. We need to be much braver, I think, with this, and we need to be really getting out and pushing that message as much as we can across all sectors.
Isabel, thoughts from you? And then there's a question in the crowd, I think.
I guess one thing that I'm hearing is that I was hearing particularly today was around making sure that the sort of data and the information is coming out into actual practical solutions, and also including society. And that there was discussion today about the difficulty of having these great solutions, and Valencia was actually given it as an example, but having them not be implemented when they need to be. So that discussion about the information about what would have reduced the terrible impacts of that flooding was actually available beforehand, but it wasn't being, the local communities didn't have enough understanding, and the people working around didn't have that information in a form that led to change. So engaging with local communities as part of any change to make it actually happen. And then using those examples where there has been a good change that has been helpful to build on. And I think there are examples on the flip side where someone's done something innovative, or a community has, and then being able to actually draw on that for other places, but making sure that our science and our health messages are reaching local people and local.
Yes. I think that's so true. And I think there's still a problem, and this is a global problem, but certainly we do this in Australia too, where we design our climate policy and solutions for communities, not with communities, not by communities. And this doesn't mean that we put the entire burden on communities to get it done, but we need to understand where communities are coming from to be able to design meaningful policy. I think one of the other things that we've seen as well is that we haven't been particularly intersectional in how we have implemented or designed a lot of things. So, for example, most NDCs, particularly, so we look in the Asia Pacific region, although there is some really good work happening in the Pacific Islands around disability, but disability isn't considered, gender isn't considered, all these different groups that have different needs are not considered, and we need to be a lot more dedicated to addressing intersectionality in all of the work that we do.
Can you give us some practical examples of who's talking about, if not how it's being spoken about or actual interventions, but who's talking about it? Because that's also a nice clue for us. Who is talking about intersectionality, cross-sectoral working? Is it the health people, or is it other sectors as well?
Look, and you have to understand the biases that I kind of gravitate to the health events here.
Of course.
So I've seen it from the health sector. Look, in some country pavilions, particularly there is the Amazon pavilion I was at the other day, and there were those conversations that are kind of being led by First Nations communities as well. That's where I've seen it the most. I don't know about you, Sibel.
Well, certainly this morning, and this was something that wasn't actually from the country of Singapore, but it was hosted in their pavilion, was this funding organisation that has decided to pivot to the intersection of climate, health, and it's a fairly modest investment. It's a $5 million lighthouse fund, but it is specifically to look at climate and health intersections. And all the people that they had presenting there were talking about that important connection, and they're really around adaptation. They were acknowledging and saying, yes, we definitely need to mitigate, but also saying, look, we actually have to bring adaptation far more into the centre of this, because we already need that. And without that, we aren't going to be able to, it's crucially important, and we need it for the sake of health and human beings.
Yeah, absolutely. And I went to an event, I was invited to a roundtable a couple of days ago that had World Bank, World Meteorological Association, GCHA, Healthcare Without Harm, London School of Hygiene and Tropical Medicine, just a kind of scattered room of people. There was really a workshop to talk about these things. And we had some really good discussions across that quite diverse cross-sectoral group that were along these lines as well. So I don't think it's just health that's thinking about this.
Yeah. Great. I mean, that's a really positive thing to hear about, because I remember last year we were trying to make a lot of efforts on this front of cross-sectoral working, but also the solutions framing. So, there were 3 pillars of the COP28 health program, and one of the pillars was around getting ministerial buy-in and action. So there was that big health ministerial event. Fun fact, I think there were something like 52 ministers that came to COP last year, health ministers, that is. And that's more than the total number of health ministers that ever came to COP before. So I guess that, we're reaping some of the rewards of that the things that were done by the total health community last year at COP. So that was one pillar, right? Thinking about the health in the agenda. Financing was the second pillar, but then the third was very much this, solutions, cross-sectoral working, because obviously health exists in all, whether you should say policies, whether you want it to be across all areas of economic action. We're there, or we think we should be there. So great to hear this. I think there was another question in the audience. Kaylin, would you like to ask your question?
Yes, actually, oh, my camera, there we go. Camera, does it work? Anyway, doesn't matter. You know what I look like. Thank you so much for taking the time. It's been a really good and very interesting to see what's happening on the ground at COP, and especially after Health Day. And my ears perked up when you were talking about, countries that are actually implementing solutions, because I see a lot at the sort of local level. You mentioned like Paris making it a car-free city. And so I was like, all right, what are some examples of countries that are really doing it across the health and all policies, that are sort of getting it right? Because I think we see a lot of mistakes, and we do a lot of, oh, don't do financing that way, don't do our adaptation that way. But looking for yes, we should do it this way. I hold up the UK for their decarbonization efforts, their climate act, where they said we will go to net zero, had amazing flow-on effects. And that seems to have set the tone. Are we hearing things where countries are really setting the tone? Are there really good examples coming out? I know that was a very long question. But it's about, and you did give some wonderful examples with the Amazon and such about what's happening at COP29. But are we seeing that learning building? Are we seeing that being as a thing that's being showcased, where people are coming forward and saying, we're doing this and you should do it too?
I would have said that the example of the UK is the main one that's been given that I've heard. That in a sense that there was a bit of a sense of, oh, well, who's going to do something that's positive and forward thinking, and that announcement by the UK around their climate policy and their kind of going to good action on climate change internationally is something that I think has stirred people up and got more interest happening, rather than this being a race to the bottom. There now being a kind of a bar that's been set higher again, which is really good.
And such an enormous opportunity as well, I think. It's what we see when you ask that question, what immediately comes to mind, unfortunately, is that it's not the big global north countries that are leading on this, right? And it's ridiculous because it's such a great opportunity. But the things that come to mind for me is like, okay, I know Costa Rica has reforested to the degree they have more rainforest than they did in the 1970s. They're doing amazing things. There are a number of countries who are doing really great health implementation and have negative carbon emissions, but they're the small countries who have not got us into this mess. And we haven't seen great leadership from the global north on this yet. I think the UK is probably going to be the leader on this, but there's no reason, if Australia decided to do it, we could do it.
Yeah.
If you look at the fact that, so the Fossil Fuel Non-Proliferation Treaty, which I clearly am quite biased towards, I think is absolutely fantastic. If you look at the countries that have signed on to that, it's not the big countries. There is no big global north country. Who will be the first country? Because that would be a fabulous signpost.
Yep.
There is so much potential to be a leader in this space. We just need them to step up.
Yeah. There've been a lot of actually good examples where investment in Uruguay getting all of their renewables, and Africa having more investment in solar. So there's some good pockets where you can see that that disinvestment in fossil fuels, and where countries are going also more for their own internal stability. We need to make our energy here, so we're not linked to the rest of the world making their chaos. And I do apologize for my home country of the US and whatever they do next. But Inflation Reduction Act was actually one of the biggest. The US became a real driver in green energy. Just nobody knew about it. We don't talk about it.
Yep.
So yeah, there
And
are
I think
pockets.
yeah, definitely. It's worth noting as well, there is legislation from the IRA that can't be removed as well.
Yes.
So that's a legacy that will persist.
And a number of the places that benefited were Republican states, which are not going to be keen to have the money taken away.
Yes.
I just wanted to point to another sort of a positive thing that I've heard about. So we, at the Global Methane Pledge session yesterday, no, the day before, there was the person leading that in China who was speaking and talking about how they were finding ways to measure, and they'd actually had some progress on this happening across China of measuring how much methane emission, including from abandoned coal mines. And actually they've had a reduction in what the acceptable amount of methane leakage is, from something like 30% to 8%, and that's actually been legislated. So,
Nice.
and they've got mechanisms for reducing it. So they're thinking about, and not just thinking about, but there's examples of action at a local level to reduce the amount of methane. And I also met with someone who'd come from Mongolia and was promoting transitioning from coal-fired power to solar, and was really interested. And we exchanged details about getting information about the benefits to the local community around, lung and heart disease and pregnancies and stuff. And just actually having access to that health information, she was really excited about, because she was going out to communities to say, look, you'll be better off with this solar, but she'd be getting pushback, and actually having access to that information was a way that she could see being able to make more progress.
So knowledge is power.
Excellent.
And we're sharing the power somehow by sharing the knowledge. So look, it's been fantastic to speak with you, and thanks so much for doing all that you're doing over there. It's not easy. It's a grueling schedule, and I'm sure it's not all cocktail receptions and everything, but let me end by asking Kate or Michelle, any words, any reflections on what Sibel and Kimberly have been sharing with us?
I'm quite uplifted by this, actually. Yeah, like I was coming in today thinking this is going to be a pretty gloomy conversation. It's not going to be, oh no, we've got the US is withdrawn, and no one wants to say phase out, and we're in a petrochemical state, and all of these things, and certainly there is a lot of bad news to be found if you keep looking. But what you've both done is found the positives and highlighted them, and looked at how the work that's being done by states, the work that's being done by private actors, the work that's being done with collaboration, and that sense of need, and that sense of the shared understanding around need to act. And so thanks. I think that's just lovely. I'm sure Michelle has comments.
Well, I think similarly, I feel really buoyed, and I feel grateful that you're both there, meeting people from different sectors, from different countries, and and being those trusted voices, and being those sort of ambassadors for health. And so I'm just really excited that you are there. And I think the work happens, yes, in the negotiations, but it absolutely happens outside and across sectors. And I felt it this morning when I spoke with those Pacific leaders, and what they will take from working together. So while negotiators might be determining their future, seemingly, they are actually gearing up, and as are you and the other actors that you meet. So yeah, I'm really buoyed, and I think that I really look forward to seeing what else you learn and are able to bring home. And yes, please shout out if we can support in any way.
Thank you so much, everybody. And thanks, Addie, in particular, for driving this and making it happen. So I think my last word would be, next year, COP Brazil, I think there is already a lot of momentum that's building towards that, particularly in the health community, which I think is really exciting. And looking forward, let's say Australia does get it for 31, then we have such an opportunity to really push health in the planning of that meeting, I think. And exciting times ahead, right? There's a lot of change we can make, and I'm really happy and glad and proud to be part of this community with all of you.
I would echo that. Really, really delighted to be here. And I do think that there are, in reality, some really hard things, but that's not the only thing that's going on. So thank you.
Fantastic. And I think both of you have really demonstrated for us this quote that I've learnt recently, and many of you will have heard of this quote. About 100 years ago, there was a person sitting in a prison who said, we need to have optimism of the heart, perhaps. I'm sure I'll misquote this. Optimism of the heart, pessimism of the intellect. So, you know, we have this two-track where so many things are not quite how they should be, but we can get there with this eternal capacity for human hope. So maybe that's a good enough note to end on. Thanks for all your work. Remember, we're coming live from Baku, thanks to Kimberly and Sibel here. What else can we say to close, Kate or Michelle? I mean, the Climate and Health Alliance conference is happening. The Greening the Health Sector Forum is still on this week, so tune into that.
We've also sent out to our members, and we'll share it on socials. We've created a dedicated page with a whole lot of resources that link to the different COP themes and also the events that you can tune into. Some of you put your hand up to have virtual badges next year. Yes, we will, with our friends at DEA, organise, you know, a bigger delegation if that's what's, you know, on the cards. So we'll do that early in the year, but for now, yeah, tune in and and take away some of these great threads from the conversation today.
And likewise, Kate, I think there'll be lots of DEA activity coming up. There's the Rising Tide blockade of the world's largest coal export port, which happens to be here in Newcastle.
World's largest export port in Newcastle next week, and then there's the Canberra Wave the following week outside on Parliament House lawn. So that'll be an opportunity for us to get that federal action going when we know that the states are doing things. And I'll just say, Artie, that your definition sounds like active hope. That sounds like the definition of hope for me. And so let's all get on and do that.
Yeah.
Let's have hope to be active.
And when you want even more facts and figures, you can tune in next week to the HEAL Network Healthy Environments and Lives annual conference, which is happening virtually. So that's the 26th to the 28th. Look, thanks very much, everyone. That's our time, I believe, and we'll see you next time around. Thanks so much.
Thanks, Artie.
Bye.
See you, everybody.
Bye.
Bye. Nice job, Artie.
Thank you.